going to need everyone to stay out of my office today.
Well, my office is in your office.
But then you're going to have to get creative, aren't you?
Oh.
Having another scheduled breakdown, Vera?
That was one time, and also never happened. And it was also a vicious misunderstanding of events. No, if you lot must know, I'm hiring someone new for the hospital today.
You hiring someone else?
Yes. I thought with the extra funds coming in, the place could use an improvement to the staff.
I resent that.
If you must. No, it shouldn't be anything too drastic. A dentist, a new cook, a new leech collector.
Oh, never did like dentists. Bloody sadists they are. You know, anyone can pick up a pair of pliers and call themselves a bloody dentist.
Right, well, all of those ladies are coming in next week, but I wanted to get today's out of the way early. It's a touch unseemly. That must be Mr. Nide now. Please try to keep it down to a dull roar, everyone. Mr. Nide. Thank you for coming. We'll just be right upstairs.
Oh, big lad, isn't he? I wonder what he's here to do.
Goodbye.
Hold on a moment. You don't think he's here to replace me? What, just because he's big and strong means he's made for a better surgeon? There's more to surgery than just strength.
Denial.
Don't you bloody start with me. For all you know, he's here to replace you.
Me?
Well, why not? What you do ain't so difficult. Anyone can just go around screaming random bloody diagnoses.
Well, maybe. He's here to replace Nurse Claire for him.
No. She does great work.
She's very efficient.
And great attitude. Oh, no. We're making a fuss over nothing. Nobody is being replaced.
Of course not. We're the Sawbones Society. They don't just let anyone in.
Have you ever worked for a hospital before, Mr. Nide?
More so as an associate.
Well, we would like you to work exclusively for us. Currently, we're taking in more patients than we can handle.
Business is good then?
Well, it would be on your end. I must warn you though, we work very erratic hours. You might be summoned in the middle of the night.
Good thing I'm a night owl then.
That's what we like to hear.
Sorry to interrupt, Dr. Morphine. I just thought I'd bring you and your company some tea.
Just set it anywhere, Alexandra. Oh, Mr. Nide, this is our alienist, Dr. Alexandra Heroin.
Good to meet
You as well, Mr. Nide. Might I ask what brings you by today?
Was there something you wanted, Dr. Heroin?
No, I just came to bring you some tea, see if you needed anything. I know with you being such a chronic do-gooder, you sometimes forget to think of yourself first.
Right.
And might I just say, it's a wonder to study such a genius. Someone with such mental acuity.
Is this about your salary? Because I told everyone I would not be discussing raises till the end of the month.
No, of course not. Although, I did hear Mr. Ether say he was going to ask for double.
Can you imagine? Ask him if he knows any other jokes.
If you ask me,
I didn't, but go on.
he seems to cost way more than his worth.
Ain't that the truth?
I mean, some of us don't have a crippling drug habit.
I had best get
Yes,
back to work.
yes,
I hope
you'd
to see
better.
you again, Mr. Nide.
Hopefully not too soon.
Goodbye.
Goodbye.
Goodbye. Ta.
She seems nice.
She does. I don't trust it.
So whatever happened to making a fuss over nothing?
It pays to be nice.
Oh, so that's how you want to play it then? Kill him with kindness? Alright, have it your way. But, two can play at that game.
You're out of your element.
Oh, you ain't seen nothing. You think you're the only one who can grovel? How do you think I got this job?
I don't know, but you better be ready to do it again when she replaces you.
Just you wait.
We're renting the land from a local farmer, but to be honest, we haven't found much use for rented buildings. There's the carriage house back there, and then there's the slaughterhouse here.
Oi, Vera!
And then out back, there's plenty of room for new additions, which we're going to need thanks to the amount of patients we currently have coming in.
Was that your name?
No, I don't think so.
Vera!
It's probably just the wind.
Hi, there you are, you lovely thing.
What do you want?
Looking everywhere for you. You certainly do know how to keep a man waiting. Oh, I'm so sorry about that. I've been in the slaughterhouse all day.
Oh my God!
Never can do too much work. That's me motto. Mr. Ether, how do you do? I hear you're going to be joining up with our glorious group of Sawbones. Listen, don't mind me, mess. It's a hazard of the job. I'm sure you know all about that.
Hard to keep my hands cold.
Say, Mr.
Nide.
Oh,
Sigh,
God.
Nide.
Mr. Nide, I've got a little. Say you can help me have a bit of a spot. See, I've got a lad on the table, and he's green as grass in an area which I won't mention with the ladies present. What would you advise?
A coffin that only opens from the top.
What do you want?
You wound me.
I could.
I've been looking for you, of course.
Oh,
what else?
Is this about your salary? Because Dr. Heroin said that
Oh,
you were there.
never mind that woman. She doesn't know her brain half the time. She's probably on drugs.
Only if she's lucky.
Besides, I heard she was treating patients on the side. A little under-the-table action, if you know what I mean. Not that way, Mr. Nide. Not that I would know. What she does in her business is none of me business. Unlike her, I am 100% committed to the job.
Look, if whatever this is could wait until later.
Of course, Dr. Morphine, I live to serve our glorious physician. I am at your beck and call.
How about my shoe and sand?
Such a sense of humour on this one. Be seeing you, Mr. Nide.
Hopefully not too soon. He seems...
Oh! That he does, all right. That he does.
Are all of your associates like that?
God, I hope not.
I'd say I've got that one in the bag. Strong or not. New lad doesn't know a thing about surgery. She'll see that.
Did you tell her I was a drug addict? That's so rude. You're the one who's high right now.
Always, but that's expected of me. When you do, it's unprofessional.
I can't believe you. This is ridiculous. You're the one who's being replaced, not me.
Aren't you?
No.
Denial, leading to anger. You can't run away from your problems like this. Acceptance is the first step to healing.
Go away! Well, Mr. Nide, I think you're going to be an excellent addition to the hospital. But, mum's the word, eh?
I can't even tell my friends.
No! Listen, if you get caught by the authorities, we've never heard of you.
Dr. Morphine, if I get caught, I will sing like a canary.
Fair enough. Have a good afternoon, Mr. Nide.
Mr. Nide, fancy seeing you here still.
Mr. Ethan. Dr. Nurse.
Firefly.
Right. Is there a reason you're interrupting?
Yes, actually, there's a matter that requires your assistance. You can just come with us. It's this way.
I do need to get to my job.
I insist.
I'd really love to pick your brain.
All right, come on, get in there.
It's a weird day when you're the only one acting normal.
Yup, that's cocaine. You should really label these things.
I wonder what's the matter with everyone else. They must really want raises.
Well, I'll be sorry to see one of them go.
How do you mean?
Well, that's what Mr. Knights are for, isn't it? So one of them packing.
Oh, shit!
All right, my friend. We can either do this the easy way or the fun way. Just tell us what we want to know.
What do you want to know?
I will ask the questions here.
You haven't asked me anything.
He has a point.
Who do you work for?
Dr. Morphine?
We already knew that. Ask him something we don't know.
What does the A stand for?
Nothing. I just thought it sounded classy.
Something we care about.
He's not talking.
Who are you here to replace?
I don't know.
Don't lie to me! I need this job, mate! Don't you see that no other hospital is going to hire me? Oh God. Oh God. Oh God, I'm gonna have to go back to taking the limbs out of the machinery and clearing the skin off of the gears! Oh.
I refuse to go back to Witchwood. I won't spend another 5 years toiling away in that asylum.
Don't you see that this job is all we've got?
What are you doing to Mr. Nide?
Don't act like you don't know.
Put Mr. Nide down! Oh,
I can't believe after all the years of loyalty I have shown this society, you would callously replace us the second you get a bit of money. Well, I am hurt. I am betrayed, and we are not going to stand for it.
I agree. Either he goes or we go.
Mr. Nide is our new grave digger.
What? Resurrection Man? At your service?
I told you not to call it that.
It's half the reason I took the job. Sounds a lot better than Gravedigger. Or Body Snatcher.
How about unemployed?
Well, we're not being replaced?
No. I mean, think about it. Where would I find another alienist, or surgeon for that matter, that I could pay so little?
So, we're not getting replaced.
No! Who even gave you that idea?
What? You said. No, you said!
Oops.
Gentlemen, are you lonely, ugly, unfulfilled? Do you leave women unsatisfied? In conversation because you're boring? Yes, you are. But never fear, gents. We have the solution to all your problems with women. Or other men. We don't judge. Miss Abby Sinthe Miracle Pills will make a man out of you. Possible paramours will faint at the sight of you, and not just from the horror anymore. Get up and go with Miss Abby Sinthe Miracle Pills. Side effects may include swelling, overconfidence, permanent dysfunction, sterility, and impulse to run for government. Do not take Miss Abby Sinthe Miracle Pills if you like who you are as a person. Do not take Miss Abby Sinthe Miracle Pills if you have already consulted a doctor. Ask your local quack if Miss Abby Sinthe Miracle Pills are right for you.
Oh, yeah. Oh. All right. Time me.
Did you know cholera is waterborne?
No.
Time!
46 seconds.
God damn!
Hot iron or boiling tar today?
Oh, what's it matter? I'm a fraud.
Yes, you knew that.
Oh, I'm never gonna be 29 seconds. What's even the point of surgery?
I don't know, Mr. Ether.
Have you prepaid your burial fee?
Are we still offering that refund? Have we had to pay it out yet?
He has another leg.
What? Oh, come on, what are you crying about? It's only surgery. You want to be lopsided the rest of your life?
What an awkward week that would be.
Don't worry about a thing, mate. This one be on the house. Right. Time me.
My name is Dan Ford, and I play the character of Edward Ether in the Sawbones Society. Alright, so Mr. Ether was a character developed for the Sawbones Society, and when coming up with a backstory, I wanted to figure out something that tied in both his love of surgery and his addiction to this horrible drug. So Ether is a drug that is synthesized using sulfuric acid and ethanol, and it is technically known as an anesthetic. And the thing that made ether so popular amongst medical professionals was the fact that it was an anesthetic, and this was when most surgeons were working in the pre-anesthetic era. And what also made it very popular is that it had a very high therapeutic index. And what that means is that you could give a patient a higher and higher dose, and they would pass out at more variable rates before their blood became too toxic, and that would eventually kill them. Now, ether itself was first formally introduced to the operating theater in 1846 by William T.G. Morton in Boston, and its first demonstration in London was by Robert Liston. Now, there is some speculation that William T.G. Morton had been secretly using ether prior to 1846 as a dental anesthetic. So a surgeon in the 19th century was more akin to a butcher than they were an actual medical professional, but there is an important distinction here. That was only true for the beginning of the 19th century. It was right around the middle of the 19th century that we began seeing surgeons become more akin to what we would consider medical professionals, but the practice then was far more barbaric than it is now, comparatively. Bear in mind that if you were a surgeon and you were working prior to 1846, you would actually have to work under horrible conditions in which the patient was conscious for the procedure, meaning that they had to devote more of their specialization to time rather than skill of actually hacking off a limb. Back then, there was very little use of disinfecting agents, which means that more patients were likely to die of post-operative infection. As a result, mortality rates back then would skyrocket, and as a result, outbreaks of what became known as hospitalism, or outbreaks of gangrene on the hospital wards, was very frequent. So the style of surgery of prioritizing speed over expertise is what prompted Mr. Ether to carry around his comically oversized bone saw, which was basically meant for the purpose of getting through a limb as quickly as possible, not necessarily as painlessly, because the procedure was already horrifyingly painful to begin with. In several instances, you'll see Mr. Ether timing himself, and this is because there was a major competition among surgeons to see how quickly they could remove a limb. Robert Liston still holds the record of removing a leg at 28 seconds. Now, this is actually something that still carries through today. Surgeons themselves are actually constantly timing themselves of how fast they can perform procedures, and the tradition of informal competition does continue to this day amongst modern medical professionals, because it is a symbol of status in the medical community as to how fast you can accomplish a procedure. Even though the speed of the procedure was alleviated by the introduction of anesthetics, you're still trying to work against the clock because there's only so long that you can have a patient open during these times. So in the 19th century, particularly towards the middle of the 19th century, you began to introduce what was known as operating theaters. And when I say theaters, these were literally open theaters in which it became standing room only amongst other onlookers and medical professionals hoping to look in on the procedure and hopefully glean some knowledge from that. Unfortunately, this led to them bringing in a whole bunch of outside infections into the operating theater, which would crowd the surgical environment, eventually infect the patient, and it made the surgeon's job a lot harder because eventually they would have to either clear the operating floor themselves, which of course slowed down the procedure and was a major nuisance towards them, and also the introduction of outside materials and infections became an even bigger risk for the patient. But This was the only way that medical students were going to learn how to hone in their practice. The other thing about the operating theater is the effect that it had on surgeons more than patients. They would have to go into these horrible procedures with people screaming and crying and carrying on, which of course had an effect on their nerves as well. And this post-traumatic stress disorder is why Mr. Ether is addicted to drugs. He uses it constantly before surgery so that it will calm his nerves about the procedure, and why he can't go for too long without it, because unfortunately it has become a drug of habit. The clothes that Mr. Ether wears was actually very typical of a surgeon. You wouldn't think that surgeons would be wearing bloodied aprons with crusted guts and gore all over them, but they actually would. And that's because the amount of blood you carried with you on your apron was a symbol of status, because it meant that you were an experienced surgeon and you performed many procedures. But unfortunately, this was also bringing in a lot of outside infections, and then you were mixing body fluids with body fluids, especially for the surgeon themselves, and this is why they would also get sick as well. So Mr. Ether is Mr. Ether as opposed to Dr. Ether, because in the early part of the 19th century, surgeons were not actually considered medical doctors. The qualifications for surgeons were much lower than they were towards the middle of the 19th century, because all they really had to do was hack off limbs. So the qualifications you had to have going into that field were much lower, but that changed as the 19th century went on, and more institutes like the Royal College of Surgeons were introducing more stringent qualifications for persons who want to become surgeons. And then that is where we get the idea of what's known as graduated autonomy, which is how surgeons eventually become their own people. They work a little bit on one patient while being overseen by a professional surgeon who's had many years of experience, and this keeps going until they can perform the procedures themselves and eventually teach others. Mr. Ether doesn't get along with Dr. Morphine because she won't give him a raise. Also, Mr. Ether and Dr. Morphine represent two completely different fields in the medical community that don't particularly respect each other too much, given their different areas of expertise, their perceived expertise, and what they actually do in terms of medicine. So even as more qualifications were being introduced and you had to become a doctor before you could start practicing surgery, it was very common for those going into this field to revert back to their Mr. status as opposed to doctor, because of the fact that they want to reject some of the practices of the other upper echelon of the medical community.
Hello, Mr. Nide. Oh, greetings, ma'am. Leeches are biting today. Oh, that's what we like to hear. That's your cure, no matter what the ailment. Oh, look at that. What do you think today? Oh, don't you worry, ma'am. These legs, they'll get all the strongest leeches for you. All right, well, thank you very much. Oh.
Dr. Morphine. Pleasant to see you.
Did you happen to see the bodies up by the house?
Oh, I'm afraid I've gotten a bit sidetracked.
Oh, well, there's been a bit more since this afternoon. Mr. Ethan's on the record again.
Again, I say, of course.
Yes, if you can get those taken care of.
Right away.